Welcome to our webinar, the fifth in this series on Horizon Europe. This time we are talking about Cluster 1. My name is Agnieszka Weiner and I will be your moderator today. The webinar is organized by the delegation of the European Union to Canada. And as I mentioned, is the fifth in this series. The next one on Cluster 3 will take place in June. Today, it's really a good timing because a few weeks ago, the European Commission actually published the work program for the next period of Horizon Europe. And this is why we can finally talk about very concrete examples from the work program and also give you the tips that you can actually use. So today on the agenda, we have very exciting presentations. We start with a presentation on the work program and Cluster 1 Health with the NCP Isabel Carvalho Oliveira from Portugal. And then we will talk about the actual proposal writing with our expert on Horizon Europe, Maria Pawłowska, whom many of you probably already know. That presentation will be followed by an insight on evaluation in Cluster 1. That will be presented by Professor Marina Alameda Silva, also from Portugal. And then we will have a panel on a very exciting project in Cluster 1, Rescue Plus. I'm really excited about it because it's a very unique project that brings together technology and health. And I'm sure you will be interested to know more. And we will finish with the presentation from ICET on how the Canadian researchers can use the services available to them here in Canada, especially in Cluster 1. So without further ado, I wanted to start. However, I just have to remind everyone that if you want to ask a question, please use the Q&A function. You can ask the questions throughout the webinar. We will be answering them as we go. So do not hold off, until the last moment. Our experts are here to answer whatever you need to ask. So I wanted to then welcome Isabel. So Isabel has been working at AICIB. It's as a Portugal delegate and national contact point for health in the European Research Programme. Since 2022, so it means that she has experience in Horizon 2020 and now Horizon Europe. But she also has a degree in biology genetics and PhD in molecular biology. So we are all researchers here. Isabel is also an expert on ethics, and this is actually an important element in Horizon Europe. So yes, Isabel, please, the floor is yours. Tell us how to find our way through the new work program.
Thank you very much, Agnes, for your presentation here and for this session. I would like to welcome all here and thank you for inviting me to be here. I shall start putting the presentation. Please let me know if if everything is okay.
Looks great.
Yeah, okay, thank you. So starting, so we have here the cluster health. It's one of the clusters of Horizon Europe, and I will start first telling you that I'm NCP, as Agnes was saying, and also delegate, and I do this along with two other colleagues, Anabel Isidro and Ana Rita Pinto. You can have our contacts if you need to contact us later. But first, to explain a little bit what are these two roles as delegates and NCPs, because I think that's also very important for you as researchers at Canada to know these roles and to know exactly what you should do or not, or with each of the people that you might have also in Canada. So as national delegates for the cluster health, we gather all the priorities that are identified in this area of health. It also exists for other areas, but we listen to the community and we try to take those priorities, those research priorities in health, to the European Commission so we can better define the work program. So we are each of the member states and also the associated countries, we try to collaborate in the definition of the work programs. And that's how we do it, through the delegates. So this is important that you know, so you can also transmit your health needs or health research needs to your delegates in Canada. The other rule that we have is as national contact points, and this doesn't happen the same for all countries. In Portugal, we all have these two hats as national contact points and delegates, but in other countries, there are people that, or these roles might be in two people separately. So as national contact points, we do a little bit the other way around. We bring the work program to in this case, to Portugal, but to our national communities. We try to disseminate the work program. We help the researchers to identify the calls that might be better suited for what they are working in or they are interested in. We try to advise them in some areas, even in advance, that if we know that they could be if you know, for instance, there is a project that it's being prepared and that they can join or something. It's not very often, but sometimes we do that. And we can help them not doing the proposal, but reading the proposal. We usually just do this for the coordinations that are Portuguese coordinations. And give some hints, give some tips that could help the proposal and also help in all these administrative issues until you have the submission done or the budget prepared. And even after the submission, if the project is accepted, which is all the time what we hope. So we also can try to help them after the project is approved, also in legal issues, if not us, the NCPs for legal and financial issues. We also have one of those. And so this is just to show you these two rules, which I think it's also very important that you know about, because it's how you can also try to contact one to influence the work programs, the other one to take a better advantage of the work programs. And for Canada, from what we know, there's at least two national contact points. Actually, I don't know if they are here or not. In the beginning, they were, it was not possible for them to attend. But you have Barry De Bruin, and he's a national contact point for Canada for the cluster health, and also William McRae, and both of them will be available for your questions, and you'll have their contacts here. So it's a way for you to know your national NCPs. So starting really with the European Commission and the Horizon Europe. So just to give you an idea of how all this starts, the European Commission, we have now a commission that started in 2025 and it will last until 2029. And this commission established several, or in this case, 7 main policies. And these are the ones that are listed here. And based on these policies, all the Directorate General, they create their strategic programs. And these strategic programs then influence all the work that will be done under these directed generals. In this case, we're talking about mainly on the research and innovation directed general. So RTD, it's research and technology and development. We don't say that much, but that it's the one that has the work program for the Horizon Europe Horizon Europe program. Just to give you a list of the programs that are funded under the European Commission, there's more or less 40 programs. One of them is the Horizon Europe. So it's for research and innovation, but there are other programs, and then you have to look if Canada also is having a association contract with those work programs or not, but there might be, so you can also look for those. And we have other programs like health, the health program, because this is health, but under the research and innovation. The health programs, the Youth for Health, you have the Digital Europe program, we have many other programs that you might be interested in, and but then you have to see if it's fitting or not for Canada to participate. So talking about Horizon Europe. Horizon Europe, it's a 7-year program. It's on research and innovation. As I told you, it's not on health, so it's research and innovation in general. It lasts for 7 years, so it will go until 2027. And it's mainly composed of 3 big pillars and 1 transversal area. It has about 95.5 billion euros and for the 7 years, and it's more or less structured like this. Pillar 1, it's more fundamental research, and it's where you probably heard already about the ERC, the European Research Council. Then you have the Pillar 3, which is more on innovation side. So it's and you have there the European Innovation Council, that it's new in Horizon Europe. It was not present before in the H2020 work program. That was the research program before Horizon Europe. I was talking about these 2 before because both of them, Pillar 1 and Pillar 3, are bottom-up pillars. Or what does that mean? It means that it's not predefined the topics that you have to submit your proposals on. So as long as they are excellent for Pillar 1, or as long as they are very innovative in Pillar 3, they can be accepted. Then we have Pillar 2, which is the other way around. It's a top-down pillar. Here, it's where our role as delegates work. So here, this pillar is divided in 6 clusters. The first one is cluster health. That's why cluster health or cluster 1. It's the same. And here is where we gather all the gaps that were identified by the member states and associated countries. And we try to build calls that should fulfill the needs that were identified in research in these areas. So here you have the cluster health, and here what you're going to find is really you have to answer to the what was identified by the Commission. So it's not up to you to say, I'm going to work on this because this is the area that I want. Is you're going to answer to the needs that were identified. You see if you can really have the capabilities to answer to those needs that were identified there. Just a last note, you also have here the widening. It's a transversal area, and here it's not, I know that Canada cannot participate in this. I think at least as a receiver, this Ari, it's I tell you the rationale. It was because the commission noted that most of the time the projects were the succeeded projects were from the same central countries. And the issue was because they were more developed in terms of research. So this widening participation here, it's for capacity building and training for the countries that are not so much developed under research and innovation, so they can be more able to have the same level as the more developed ones. So this is only for countries that have a certain indicators that are not so well established in terms of research and innovation. So it's not for doing research, it's really for capacitation. So cluster health, it's, as I told you, it's the first one in the pillar 2, so the strategic pillar. And in the cluster health, we have 3 main modalities. The work program, where you can find the calls, the topics in several areas. I will show you how this is divided. Then you have the European Health Partnerships, where you have already a strategic agenda behind each of these partnership. And so the calls funded in each of these partnerships are based on a strategic agenda where it's not random calls. They are really trying to fulfill a goal that is established on that strategic agenda. And then we have Cancer Mission, which is even more ambitious than the partnerships because it goes even beyond research. You can even have calls for legal issues, for doing platforms, not so much, not only research. So they are all different kind of funding areas that can be funded under the cluster health. But we will focus here now mainly on the work program. As Agnes was saying, it was not some weeks ago, but it was some hours ago. It was yesterday that the work program was published by the Commission. You'll have the slides available later, I think. And here below in this blue line, you have the link for the Cluster Health Work Program for 2025. And just to let you know, or to show you where you can also find it, and you can do it already, you have the Funding and Tenders portal, which is the portal, the European portal, where you have all the calls, all the funding topics in all programs. It's not only Horizon Europe. You can find this here, everything. You have an area which is the reference documents, where you can find the guidance and work programs. And you have there for all the clusters, all the work programs that are available. And I advise you to go and search for this PDF of the programs, not only go and search for the word of a topic that you're interested in. And I explain you why. For instance, if you're looking for diabetes, and you go and put a keyword as diabetes, and you might not find any topic really related to diabetes. But if you go and look for the index of the work program, you might find topics for chronic diseases. You might find topics to build a device that will help on diseases that have a very disease burden, which is also the case for diabetes. You might find something to do research on comorbidities. So you might not find exactly the word that you're trying to search, but when you're reading the index, you have some hints of other areas that could cover your area that you're interested in. So we really advise you to read the index of the work program. And then if you're interested, then you go and look for the call and try to read the topic and see if it really fits on what you want to do or not. The work program for cluster health is divided in 6 destinations. And why do we say destinations? It's because for each of the destination, you have specific expected impacts that you want to achieve, that you want to arrive, that you want to target. It's your target. So it's where you want to get. That's why it's a destination. So the first destination, it's more focused on the health, really the individuals as a healthy person. So it's more on health promotion and disease prevention. Then we have the second destination that has calls that are more focused on determinants on health, like economical determinants, environmental determinants, social determinants, occupational determinants, etc. Then the third destination, it's usually the destination with more, with a higher budget, and it has more calls. And it's more here what we want to really, it's to tackle diseases and reduce the disease burden. So it's really directed to diseases. Then we have destination 4, that it's more for the health systems. We want to bring the health systems more innovative, more sustainable, and more that would respond more to the present needs that we have in Europe, and also I know that Canada is quite interested in this area. Destination 5, it's more for tools, technologies. So that's why I was saying that you might find here, for instance, you can have a call to bring a new device for brain diseases, and it doesn't say that it's for Parkinson or Alzheimer or whatever it is, but it's a new device. Here it's mainly for new tools, new technologies. And then the 6th destination, it really wants to bring the European industry, health industry at a global level. So it's a different area. I'm not going to enter in detail on the topics, not at all, but just to tell you, and I have 2 slides on this. This is for the 2025 work program, and it has about 700 million euros for this work program. But here you can see that we have about 16 topics. There are some other topics that I didn't bring, 2 or 3 that are mainly for the partnerships, that they also have topics they also have to be submitted. But here you can see that we have topics that are just 1 stage, which means that you just have 1 submission, or 2 stage, where you have a first smaller top proposal. And if you pass the first step, the first stage, then you submit the whole proposal, that it's more or less the same as is asked in the just one step proposals. You can see here the type of actions, and I will talk a little bit about that. You see the available budget for each call, the number of expected projects to be funded under each of the calls, and the amount per project. So this is for for destination 4, 5, and 6. So here you have all the 16 topics. So how can you read the work program? So let's explain you a little bit about this. So first you have the destination, as I was telling you, and for each of the destinations you have written what are the expected impacts, what are where you want to arrive, and you have to explain that how your project is going to contribute to these expected impacts. So under its destination, you have the calls, the topics, where you have written what are the dates of opening and closing dates, where you have the budget. As I was telling you, have the total budget per call and the estimated budget per project, which doesn't mean that you cannot go asking for more budget or less budget of what it's written there. It doesn't, it's an estimation, just that. You have the type of action, you have the expected outcomes, the scope, and the objectives. Here, it's very important for you to know that when you're making an application, and today you're going to talk about that, you really have to answer to the expected impacts and the expected outcomes in a very, very proper way. You really have to explain well how the results of your projects will contribute to the expected outcomes in a short term, and how the results of your project will contribute to the expected impacts that are under the destination. So these two levels, it's mandatory for you to answer, but you will hear more about that today. Just to, here you have an example, and this is a print screen of the topic, and I don't want you to read anything from here except this, just to show you that you have here the mentioning the budget, as I was telling you before, the budget per project, the total budget of the call, etc. And I want you to look just in two places here that I have these red boxes here. First of all, it's that in most of the topics on cluster health, and this is exclusively, sorry, in cluster health, the contribution or the participation of United States is welcome, and they can also be funded. This is in response to the, it's like many European researchers can be funded under the NIH. So this is a way to make a change, I'm missing the word, but it's a reciprocity situation between Europe and United States. And since Canada has a lot of relations with the United States, you can also take advantage of this. As I was saying, this just happens in cluster health. And the other thing is here, so you have the topic, it's it starts with the expected outcomes, then you have the scope, and then you have the activities that you should present how you're going to contribute to how you're going to develop those activities in your proposal. And it's just a highlight here that when you have in some topics you can see that you have to contribute to all the following activities or some of the following activities, and this is very, very important for you to know and for you to look when you're reading a proposal, a topic, and you're writing a proposal. So just to let you know and highlight too with this. In terms of the actions, so when I was telling you the work program has the topics, and the topics say which type of actions they are. We have three main type of actions in Horizon Europe. We have more, these are the main ones that you can see. We have the research and innovation action, we say it RIA, and it's funded at a rate of 100%. This is mainly for research and also innovation, but it doesn't have a very high component of innovation. If you have a high component of innovation, then you have an innovation action. And because it's closer to the market, it's only funded at 70%, except for entities that are non-profit, and then they also can have 100% funding. Then we have the coordination and support actions that are also funded at 100%, but here it's not really to do research at all. It's mainly to prepare programs, to have studies to see if it's worth it or not to open a call in a certain area, to prepare, for instance, for partnerships. And I have to say that I think it's not so interesting for Canada in this case. So in terms of the general rules to participate in Horizon Europe and in cluster health in this case, in all the projects that are submitted under the Pillar 2, we are always talking about collaborative projects. So in all of them, you have to have a consortium. And the consortium has to be established with a minimum of 3 entities. And those 3 entities have to be from 3 different member states or associated countries, and meaning that at least one has to be a member state. So if it's if Canada wants to lead a proposal, it has to include a minimum of 2 other entities from member states or other associated countries, but one has to be from a member state. Then you have to have a gender equality plan. I'm not going to enter in detail on this, and that's the limit of the pages. And but to show you about the consortium, I have here an example of a consortium that it's built by patients association, university, hospitals, etc. The main information here for you is that you don't have to include a hospital or university if it doesn't make sense for the activities that you're proposing. You don't have to, you just have to include in your consortium the entities that really make sense for the activities that you want to develop, that you're really needing for the development of the project that you're proposing. So it has to be rational, it has to make sense. The Commission doesn't like to have, well, this entity, it's very, very good. It usually has a lot of success in these projects, but it's not going to do anything in this project, in this specific project. So they don't like to see that. So don't make it just because it's a good entity. Put that entity if it really going to work in the project. In terms of the entities that are eligible, and I already mentioned that US entities are usually eligible for funding in the cluster health topics. You have to read that in each of the topic, but in most of them they are eligible. Then you have all the legal entities that are under the 27 member states. And besides that, you have all the associated countries like Canada, but we have many other associated countries to the Horizon Europe, and they can also participate. And the low and middle income countries in the world, they are also eligible for funding. How can you find your partners to do a consortium? These are some hints that we would like to, or that I would like to share with you. Sometimes this is the most difficult part, and we advise you to really choose your partners carefully and choose from the ones that you already know, the ones that you're working with or that you have worked with, and you try to build a consortium with them. And then you try to search for other capabilities that you might not find in those partners. Try to see if those partners know other partners that can do that. Otherwise, you can go to the brokerage events and try to search for other people, entities that might be also interested to participate in the topics that you're interested in, or even go for through the Cordis, which is a website where you can find all the projects that were previously funded by the European Commission. But we always advise you to go really for the people that you know before, and from the people that those people you know knows, because it's the others are really cold contacts, and it's not as successful as the ones that you already know. So this is my advice for you. It's much better if you do that. There are, if you want to participate in a project, you really have to be registered in the funding and tenders portal. So I just put it here, a slide where you can find this on this guidance and documents. It's a part that says really step by step what you should do to participate in a project. After first you select your project, you have to register yourself. There will be an approval of your registration in the funding and tenders portal. Just remember that you have to register. You don't have to have the approval until you when you submit. It might just happen afterwards. So don't worry if you don't have that approval. They will only ask you that after, and if the project will be accepted. So after the first project is accepted, then you have to have everything right and ready, but otherwise you just have to have a register, not more than that. And why should you really participate in these European activities, initiatives, whatever this calls? Especially for us in Europe, to participate in this Horizon Europe program, it's quite important. It's considered as an international prestige. So it's quite relevant when a researcher says, well, I was in this project, So it's quite important for your work. And you can have a lot of contact with other excellent researchers. Also, you can have access to other research networks. You can have access to a lot of research infrastructures and procedures that you might not have if you're alone. So we always advise you to participate in these kind of projects. And at the end, that's what you want. You have to have a better healthcare, better health for all. And that's it. I think, yeah, I don't know if I finished on time. I think more or less. And here you have my contact if you want to contact me later. And besides, you'll have all this the slides, and you also have the contacts of your NCPs, which is even more important than mine. Thank you.
Thank you, Isabel. That was really good. I want to actually encourage anyone who would be looking for a partner or a leader in Portugal. Really, please write to Isabel if you are interested in partnering with someone from that country. It might be worth it. Also, Isabel, we had some questions in the Q&As. We answered some of them, but I think that there is one or two for you still. So if you could.
I will try to answer, yes. Thank you.
And you can also see if what we answered was right. So
okay.
Then the next speaker today is Dr. Maria Pawłowska, who will talk to us about the proposal writing, specifically on Cluster 1. Maria is the research management expert. She is based in Nova Scotia. And she specializes in open science, data governance, and international collaboration. She holds a PhD from the University of Cambridge, and she's the Horizon Europe expert in Canada. So please, Maria, the floor is yours.
Thank you so much. It's a pleasure to be here yet again. So thank you so much, Isabel, for that wonderful introduction. It makes it so much easier to just jump right into it after such a great explanation. And as Isabel has mentioned, I know for the Canadian context, what might be a little bit, just a little bit different maybe, is the how much, if you look at the work program, which is now published, or the pre-published work program, there's a lot about mental health, and there's a lot about socioeconomic health indicators and factors, as well as climate change. So that, as Isabel has said, there's a lot of interaction between the different aspects of Horizon Europe and the different clusters. But there's also things that are very specific to health that I'll get to in a sec. First, for those of you who might be new to this is the slide that's always there at the top of this presentation. The presentation is billed as the do's and don'ts of Horizon Europe application. So true to the title, I start with this. A lot of it has been mentioned by Isabel already. Do align the topic. I mean, again, she said it all. The Commission knows exactly what it wants. Don't try to prove to them they want something else. I mean, honestly, you will fail. Give yourself plenty of time. I was just at a conference literally 2 days ago, and we were talking about Horizon Europe, and it was so wonderful to see. We did a little poll, and according to the poll, everyone in the room knew that you had to give yourself 6 months to a year to apply for Horizon Europe. These are the numbers we want to see, honestly. You want to have a comfortable amount of time to build your consortium and build your application and really think how to make sure that it's exactly what the Commission wants and you're come up with the best idea possible for them. Understand the EU evaluation criteria. They are different to what you're used to with the tri-councils. These are published online for anyone to see. There's full transparency. You don't need to be in any sort of know. Anyone can be in the know. They're on the funding and tenders portal. Please have a look at them. And plus, we will have an evaluator talking about that, which is wonderful. But it's really good to understand these. And again, Isabel had said all about it. Choose the right consortium. Just going with a great institution because they're great and they're high in rankings, that's not what you want. You want the perfect fit for your idea, and you want to make sure that it's very convincing and very obvious. There are increasingly blinded, especially two-stage blinded evaluations, where the first stage, you can't give the name of the institution. You just have to describe why they are the perfect fit. And that is also to make sure that, you know, unconscious bias isn't part of the decision-making process, and that everyone is assessed on the actual thing they bring to the project. So this is just a quick rundown. I apologize, again, I'm speaking fast, but I realize there's so much to get through. So this is just a quick sort of to-do list or how to approach Horizon Europe. You have the funding and tenders portal, as Isabel has said. This will be your friend. Well, those are not her words, but you do need to get used to the funding and tenders portal, and all the calls are there now, and you can go take a look. The work program. I encourage everyone to at least look at the table of contents for every single work program to see that there isn't something that you could work with in a cluster that seems not at all an obvious choice for you. Then you choose a call. And I think, again, quoting my predecessor speaker here, the list of things listed in the call, it's not a menu you pick and choose from. It's a checklist of everything you have to deliver on. That's really important. What they ask for, the commission, is what they want to see in your proposal. You build or join a consortium. And again, Isabel has talked about this. There's different ways of doing this. There's networking events, there's matchmaking services, and there's working with your network. That is absolutely key. Assigning roles in the project. I'll come back to that a little bit later. As you develop your work packages, again, key to make sure you align who's doing what to the roles in the project. And finally, please consider very seriously working with your friendly research services at your university. Successful Horizon Europe applications around the world are very rarely written by researchers themselves in its entirety. There are whole divisions at universities that are responsible, or research institutions in general, for walking them through this process, assisting them, and honestly doing also a lot of the writing. And I know, I'm very aware that this is not the situation we have in Canada at the moment. And I have been having so many conversations about the chicken and egg problem that we are in, where universities are hesitant to put funds into resources until there are funds from Horizon Europe, but it's very hard to get those funds unless there are resources invested at the start, right? But you do have your partners. There are perhaps other ways to get access to this assistance. It's very important to do this because researchers are very, very good at research. They're not necessarily experts at the rest of it, and I'll talk about that in a sec. So speaking of health clusters, this health cluster specifically, clinical trials and clinical studies, what they're called in Horizon Europe is clinical studies, are going to be often a big part of some of the calls. And they're always possible. They are mandatory for some of the calls. And obviously, this is not news to anyone in clinical research. There are ethics considerations. I'll show you some of this Horizon Europe specific ones. There are planning uncertainties that come with all clinical trials that need to be part of your risk management strategy and your general strategy of approaching this call. And I know there's already been a question about clinical research organizations, or so-called CROs, which are particularly important in complex multi-center studies. They can be a subcontractor. You can involve them specifically as a subcontractor. There are other ways to involve them as well, but this is something the Commission has considered, obviously, and there are streamlined processes for involving CROs. There is an additional application form specifically for clinical studies, which is available on the Funding and Tenders portal. And you need to think about how you structure the project. If you have multiple clinical sites, will they be subcontractors or partners? There are reasons to do both, but I'd encourage you, and it often looks honestly just a little bit better if you can include them as partners. So I'd encourage you to think about how that can be done. Data protection. I know that that's a big one, honestly, for Horizon Europe in general. And the dreaded GDRP that, you know, we all get shivers, or in Canada, we still kind of shiver when we hear. And GDRP is a thing in Europe. It has been for a while now, and clinical studies are very much happening, right? And it's not something that makes it impossible. It's not, obviously has not been designed to do that, and it doesn't do that. So it's designed to protect privacy. And there are absolutely ways to do that, and work with GDRP and other privacy concerns in health applications in Cluster 1 in Horizon Europe. And for medical researchers in particular, the privacy concerns are almost nothing new. This is something that in biomedical research, both the institutions and the researchers themselves are somewhat accustomed to, because it's very obvious to everyone we're dealing with very personal data that needs to be kept secure. What's important in Horizon Europe, and what I do in my presentations, apologies to those of you who have heard me say this before, I use screenshots and materials specifically from the commission itself, because these are the things you are going to be encountering as you apply. And I want to make sure I walk you through this exact lingo and presentation so that you are aware what it is when you encounter it. So there's the importance here is data protection by design. That is absolutely, the data protection needs to be part of the design from the beginning, and it needs to be implemented at every stage. So you need to be very aware of that, as well as, you know, there's a research data management plan requirement, and this is going to be a big part of it. It's also by default. So you need to automatically apply the strictest privacy settings possible. So they also tell you, which is, you know, always a relief, common sense, but think privacy. And what they're trying to do there is ask you, how necessary is it to actually get the personal data? And when I work with the commissioner colleagues in Europe, the question is always, do we actually need these people's address, for example, right? Can we just take the general neighborhood or some other information that will make it that much less possible to ever identify them, and that we probably maybe don't even need, right? So those are conversations that researchers are having in Europe because of these requirements, and I'm sure they're happening around Canada as well. It's not a new thing in the biomedical sciences. But again, with this and with the research data management plan requirement, what the commission is trying to do is trying to get researchers and administrators, study design experts to sit back and think about, what do we actually need this? We've always been collecting this data, but do we actually need it for this study? And honestly, it's surprising to researchers themselves sometimes how much data turns out to not actually be necessary for the particular study they're designing. So it's worth thinking about that. It makes it easier down the line, honestly, for the researchers themselves. The fewer data points you have that are private, the easier it is for you in the long term. This is going to be big with Canada, probably, the international transfers of data. So these are just the recommended steps. It's something I want to flag so that you are aware of it during the application process. It's something that needs to be very much considered, because if you are working in a cluster one proposal, you will have to work, as Isabel has said, with at least one EU member and another associated country. And it's almost definite that you will be transferring data in some form between the different countries. So you will need to go through this checklist and make sure that everything is legal, that you've chosen the right tools, and that any steps that need to be taken in order to ensure that everything is safe, that basically you have developed a protocol to do this. Now, again, this might be something you already do at your institution. Likely you have experience, or administrators or your data protection and research security experts already have some experience with international studies. So perhaps there's something to go back to, again, your friendly research services at your institution, or your research security expert, and ask them what is already in place. Again, you don't need to reinvent the wheel, most likely. Your partners in EU or associated countries will also most likely have something in place already. It's just to make sure that everyone talks about what they need to talk about, and protocols specific for this study are designed, implemented, and everyone is aware of them. So what do we need to look out for in Horizon Europe proposals in general, and also in specifically for the health cluster? There's gender. It is the only EDI consideration that that Horizon Europe and the Commission considers. So when you write your application, this is sort of the only part. I sometimes get questions about, for example, an indigenous stream of funding, or questions around systemic racism, which are all absolutely very real and can be included, and sometimes absolutely need to be included in your application. However, you are assessed, the EDI criterion, the only EDI criterion you are assessed on is gender. And in terms of what is defined as gender by the Commission, it's either, you can be like, you need to tick a box for the researchers, or and it's male, female, or non-binary. And that's a new category that's been included, and it's great that we've gotten there. And what you need to show is that gender mainstreaming is included in your research design. So it's not a separate category. EDI is not a separate little box you get assessed on. It's part of the excellence criterion. So you need to convince the Commission that you've actually thought deeply about how to make sure the research that you are going to carry out contributes to gender equality from the very first stage of design to how it's implemented and who it's implemented by. So just to quote, particular attention will be paid to ensure the gender balance in evaluation panels and other relevant advisory bodies. Gender balance among researchers involved in projects will be strongly encouraged and will be taken in account for equally ranked proposals. So what this is basically saying is that if there's a proposal that is as good as yours in terms of the number of points it's gotten, but they have a better gender balance, they will get the funding and not you. So they really want to ensure that everyone is doing their best to include the best possible personnel and researchers, and that also includes females. What is more, again, the cluster one specific consideration is clinical trials. And this is taken specifically from the EU regulation this is EU law. It's a directive, which directives, for those of you who might be new to this term, it is basically a pan-European law that then every country has to introduce into its own law in one way or another. Sometimes they do a paste and copy, and sometimes they don't, but everything that is included in the directive needs to be included in national law after some time. But there's always a deadline. And at the moment, there is a specific directive on clinical trials that specifies there needs to be a justification for gender and age allocation to make sure that there isn't an exclusion of, for example, historically I'm sure a lot of you who are here in the biomedical sciences know this, historically, women and even female rats have been excluded from most clinical trials because of pesky hormones. And even though this is literally 50% of any population, it's been considered the norm for a very long time, which has resulted in real life effects for women taking drugs and undergoing procedures. So this is what the EU is doing to make sure that is no longer the case. And if you do need to, if there's a really good reason, for example, if you're studying, say, prostate cancer, chances are you're not going to have a lot of women there. So that is a very good justification for excluding a particular group. But if you are excluding them, you need to justify it. And again, that is part of the law, the pan-European law and generally, if you're considering applying to Horizon Europe, I know this is not going to be very fun bedtime reading, but this particular directive, I've included all the details there. It's something worth looking up just to get a feel of what is expected for clinical trials in Europe. What else to look out for? Open science. That is a requirement in European grants to an extent it is not in Canadian. And increasingly, and the Tri-Councils are moving towards an open access requirement, and we will be now required to submit open access without an embargo period. There is also an RDM requirement for institutions in Canada, but the Commission goes beyond that. There is a more general open science requirement, which includes data deposit, which is not the case in Canada. And there are specific details on what needs to be done with the data. The data needs to be fair, and it's an acronym that basically stands for well-managed data and findable data. So it does not need to be open data, just to be very clear. Especially with medical data, there are sometimes very, very, very good reasons not to make it open, but it needs to be findable. It needs to be in a legitimate repository. By the way, these are not listed. So you get to sort of define legitimate for yourself. You also have to make sure the metadata is deposited. That is always a requirement. So again, I don't have too much time to go into this. I have quite a background in RDM, and I'd be more than happy to talk just about this for 2 days, but we unfortunately don't have time. But what it's worth thinking about, and again, talk to your friendly librarians. They will know about this. They will be honestly quite thrilled about this, because anytime you submit an paper, a journal paper, the underlying data also needs to be submitted. And especially with the medical sciences, it leads to a better world for all of us in the end. Your librarians will be more than happy to support you with this. So please go talk to them if this is something, well, generally just honestly go talk to them, because unless you personally are an RDM expert, and I know maybe some of you on this call are, but unless you know of yourself you are an RDM expert, please go talk to your friendly research librarians. What's also important, specifically for Horizon Europe, is the transition period to clinical trials registration has ended a few months ago. So as of now, all clinical trials in the EU must comply with clinical trials regulations and need to be submitted to the clinical trials information system. Again, I am just flagging this for you to go and make sure you and your partners and while you're designing the study, you are aware of this. Because again, we don't have too much time to go into the details, but it's all there. You can go and, Google is your friend, and so are your contact points and your partners and their contact points. So onto the proposal itself. This is part A. It's the kind of easy part of the proposal. It fills itself out more or less from the information that you have populated into the application system. And here's the ethics part specifically. And I've gone and pasted and copied for you the parts that are usually that you will have to consider in a cluster 1 application. I've done these talks for previous clusters, and for a lot of those, this is a non-issue. In this one, it absolutely is likely to be an issue. So you need to think, where you're working with stem cells or human embryos, you will know if you are or aren't, right? That's a pretty obvious one. It's the humans one. Are you working with humans? And what kind of work is it? Does it involve interventions? Are they invasive? Is it a clinical trial? Will you be dealing with human cells and or tissues? And what kind of personal data will you be, like cluster 1, it's very, very likely you're going to be dealing with personal data. So these are not all of these might apply to you, but some of them most likely will. And there's a part of the application where you will then elaborate what ethical considerations have been taken into consideration, while designing the study, and what has been done to ensure that the highest ethical standards are being abided by. So moving on swiftly, this is the budget. Now, the numbers in terms of how much budget is allocated to cluster 1 proposals, a lot of them are pretty big budgets because, for example, clinical trials are not cheap, right? So it's going to be large numbers, but this is the table you fill in. It's not a big table. What's important, there is no in-kind required. Generally in Horizon Europe projects, no in-kind of any kind in any project. And it's something that I know in Canada we're very used to. It's something to you don't want to be doing that in Horizon Europe. It's not what they're expecting. It's not going to help. So everything that you need to spend money on goes into this budget, including the PI's the personnel costs, right? So that's usually the biggest part of most Horizon Europe projects. Sometimes with Cluster 1, it's a bit different, but a lot of the money goes towards paying people, including the PIs, including students. That might be a little bit difficult in Canada because the Commission is assuming your PhD students and master students are employed by the institution. Again, we probably don't have a lot of time for this. This is something to talk to your institution about, the NCPs, but just remember that the money is there to pay for whatever needs to get done. However, having said that, you're going to have partners and everyone needs the money. So you need to assume that time will be spent on discussing this budget and you will have input as a researcher, but this needs a lot of input from your finance office and from your research services. This is where a lot of the negotiating happens, and this negotiating on the EU and associated countries side will not be done by researchers. It will be done by people in the finance office, and they will know what their requirements are. And chances are, if you're a researcher, you might be speaking a very different language, and you might not know all the considerations even of your institution. So it's really, again, really, really worth involving your research services and finance experts at this stage. Okay, technical description, that is proposal part B. If you are doing a two-stage, it's a bit different. In two-stage applications, it is sort of what the Commission is doing with two-stage applications. It's saying, we hear you, Horizon Europe's applications are so much work. For the ones that are likely to be very popular or be a lot of work, we will do a two-stage, where initially you just submit a 10-page description of the project. But it will include all of these parts that we will go through in a sec. It's just the page limits will be different, and the page limits are there in the application. The two-part application, it's a bit different. It's all on the tenders and funding portal. All the details are there, and the content is going to be the same, just the page limits are different. So moving on. Excellence. That is, we like to think of it as the what of your proposal. Now, what is it that you're bringing to the table? What is the vision and what do you want to achieve? And what is your unique approach? This is really important. Another very important part of this is that the evaluators that will be looking at your proposal are incredibly smart people, are experts in your general field, might not be experts in your particularly super detailed field. So you need to be able to convince anyone who knows about your area, but not specifically about that one thing you are doing for this proposal. So it needs to be written in a way that is clear to someone who might not know all the details, and yet is very convincing and highlights what is new and unique about the way you have designed to approach this. It's a fine balance, and that is why the success rate is perhaps hovering around 16%. There are a lot of great institutions applying, and they need to walk this fine line. And the other important thing is, you probably don't want to fluff a lot. And I am a former researcher, and I have worked the full spectrum of Horizon Europe applications. And honestly, I've done the whole thing. I've written, designed, evaluated, worked on projects, applied, and researchers sometimes say things that they feel they need to say to get the funding. And we are probably, or a lot of us are guilty of this. This is probably not your approach to Horizon Europe. They will see through it. There's a whole lot of applications. You want to be very specific, very detailed, and realistic about what it is you can do, can't do. There's a whole risk management section. And why is it that your idea is really good? And the reasons need to be very good. You need to be specific, and you need to be very clear on that. So I sometimes when we work on these applications, I will get the first draft and I will say, unfortunately, we need to redo most of this because I don't actually know what your idea is about. There's a lot of very big words you're using, but it's unclear to me what it is you want to do. So big words are great if they're specific and they lead to an outcome that is clear. Part of the excellence criterion is also the research data management. So you need to think hard and deep about the data you're going to be generating, how you're going to be collecting it, and what you're going to be doing with it. And this is, it again, is part of the excellence, because And there's a long history on this that is interesting to us data nerds, but I will not necessarily indulge in telling it to you now because we don't have the time. But it's very important to the Commission that this data produced with taxpayer money is treated as the honestly the gold that it is for research. And you need to show that you've really put a lot of thought into what kind of data you're producing, how, why, and how you're going to manage that data. It's really important. Again, it's a little different, well, honestly, quite a lot different than we do it in Canada, but you should have support at your university, and you're probably thinking about your data anyway. They're just giving you, they're just telling you really need to think about it, and you need to tell us what you're thinking. Technical description. This is the impact, the why. Why are you doing this? What is the important thing, and how are you going to get there? So the project pathways towards impact, and I'm going to show you what is defined as impact. It's again more broadly than you might be thinking. And how are you going to maximize this impact? This is the dissemination, exploitation, and communication. And I know exploitation sounds really bad in a lot of countries, especially perhaps in a setting like Canada, where, you know, exploitation is not what we'd like to think we're doing. But what the Commission is saying is, how are you going to exploit your research for the betterment of humanity? That is what that term actually means. And that is how you need to think about it. Please keep that in mind. And then, so how are you going to disseminate it? How are you going to exploit it for the betterment of humanity? And then communicate what you're doing. And this is the impact part. And they've given you suggestions of how to think about impact. This is taken from the strategic plan, and I'm not going to go through this. You're going to get this presentation. There are specific expected incomes and intervention areas covered. There are also the cluster, cross-cluster complementary impacts that they want you to consider along with the health impact, the health cluster. Again, you will get all this. It's a lot of writing. It's all there. It's in the strategic program, but it's here now, so you don't have to go Google that yourself. Now, this is when I said the Commission tells you how to think about impact, that this is taken straight from the application. These are examples they give you about, this is what we'd like you to think about needs, results, and measures that you're taking. And they show you different examples of impact. It is not just publication of scientific discovery on transparent electronics. It's also a product. It's also PhD students trained. It's a demonstrator, right? It's interacting, a proactive airport passenger flow management. It's interacting with end users, whether that's a company, a municipality, a governmental institution. These are all eligible partners. And with Horizon Europe, you get to think broadly past just maybe your usual partners. There are so many wonderful projects, which, for example, partner with municipalities, right? Because it's a great place to show impact. If you can get whatever innovation, whether, health innovation, you're thinking about implemented directly into a community. So they give you, again, I'm not going to go through this because you have this stuff and I have 5 minutes left. But it encourages you to think way more broadly than maybe other applications do. They tell you about target groups, about outcomes, and again, impacts. There's the questions, right? This is not a slide I made. They're very transparent about what they want, and again, it gives you an opportunity to sit down and really think how, why, and what you can achieve. Okay, this is the how, the quality and efficiency of implementation. And this is the part that researchers really do. The previous parts, I highly, highly encourage you to work with someone who is maybe in knowledge transfer, your partners, especially on the impact side, the dissemination, communication side. This might not be your forte as a researcher. There are, again, whole divisions that EU and Israeli, for example, institutions or Norwegian institutions that deal specifically with the dissemination and communication side of things, right? But the work plan and resources, this is where the researchers really sit down and work through this. You need to think of the work packages, how you're going to divide your project. This is a bit different for lump sum grants. That is just a thing I'm going to flag. There's a link to more information about lump sum in the in the resources. But in general, you want to think of work packages, and it needs to be logical, and they need to feed into each other, and it needs to be along a timeline that makes sense. You need to have deliverables. Again, very important with lump sum projects, even more so perhaps than with these. But you need to think what you can realistically do, and there needs to be, it's a bit of a Goldilocks situation. Not too many, not too much. You need to be what's realistic and important, and can actually, again, with the milestones, how can you measure the progress of your project? Risk assessment, very important, and please do a real risk assessment. Telling the commissions there are no risks is not going to cut it. That they don't fund anything. If it's no risk, then it's high risk, high gain, right? That's what we're going for. If you have no risks, what you're doing is not interesting enough for this particular call. And I can just, as a very quick example of the things you need to consider, projects in Eastern European countries have listed the Ukraine war as a risk in their, while applying for Horizon Europe, because of different things happening, right? You really need to think broadly of what could impact your project, because the Commission is giving you a lot of money, and they want to make sure that you've thought through what can go wrong, and you made sure that you've done all you can to prevent that from happening. Person months, a very Brussels speak or Brussels English speak term. It's basically who's going to work on this project for how long, and how much do they need to be paid. Very important part, capacity of participants and consortium as a whole. Isabel has talked about that. I'm not going to spend more time on it, but again, think about who you're working with and why. So what can you take away from this as of today? Go talk to your colleagues in Europe and your friendly research administrators, and find out if there's anyone working on a proposal already, or maybe you can just send a message saying, hey, Canada joined Horizon Europe. If you're working on any proposals, I can partner with you. This is going to take 2 minutes of your life, and it might be an impactful 2 minutes. Please go read the work programs. They are finally out. We're so excited. It's a great day. I mean, please go take a look. Assemble an international and local team. You really need the local backup. Please, it's very important. Again, go talk to your friendly research services. Follow the guidelines. You'll have an evaluator here in a sec. They'll give you more details. Just, it is a checklist, and they do know better what they want. So please don't try to convince them otherwise. Plenty of iterations. Prepare yourself for months of work, and assuming it's going to take time, align your work packages with your milestones and deliverables. Make sure it all makes sense, and assume the researchers will do the methodology and work packages, and not all of it. They really shouldn't be doing all of it. It's, I mean, maybe some people can. In most institutions, they absolutely won't, because they're not experts on everything. Here are your resources. And thank you very much. I think I'm just on time. I'll stop sharing.
Thank you. Thank you, Maria, for this. I think it was an excellent presentation, and actually all the consideration you gave to issues of ethics and also data protection is really important to remember in this specific cluster. And I think we will get even more insights on this and how it fits into the larger evaluation procedure. Now, when we will be listening to the presentation of Professor Marina Alameda Silva, who is a professor in Lisbon School of Health from Polytechnics of Lisbon. She is specialized in environmental health, and she comes to us with years of experience in various European projects, and also with years of experience as an evaluator. So, Marina, the floor is yours.
Thank you, Agnieszka. Thank you so much for your kind words. And hi, everyone. So, Maria and Isabel, thank you so much for your presentation. Such a great information that you share. So now my job is a little bit more hard to do. I hope you could also like this presentation. And I'm just right here today to present the data regarding the way of understanding the evaluation process. So I don't want to go deep on these because Isabel already talked about all of this scheme. We are based on the Pillar 2, and then also the way of we should move under the standard submission process. But you just keep these as a kind reminder. So we always start with the call publication. So the first step is always the official release of the funding opportunity. And here today we already saw the vast list of the call publications that we would find. And then we're starting to prepare and submit the detailed proposals. This is a hard work to do. But I believe that each of you are able to do it properly. Then we are going to the proposal evaluation, which is a rigorous multi-stage review process. I will go deep on it later on. And then we have the great agreement with the funding body. And at the end, and finally, the awarded projects are launched and closely monitored. Based on this, we have to look for the standard evaluation process. And here, a couple of highlights that I would like to share with you is the fact that all of these evaluation process must be more than just a selection. So you must know that the evaluation is a critical process that ensures fairness, transparency, and that public funds go to the most impactful, high-quality research. That's why the step of the proposal preparation, as Maria bring us before my talk, is so important. Then how we can promoting transparency. The evaluation process is a merit-based selection system that builds trust and consistency across all applicants. And then we should align these with the priorities and the evaluation process, and so helps to ensure projects that are well aligned with the key European Union priorities, like, for instance, the Green Deal and also the digital transition. Is just a couple of examples that you can find of these standards. And then what happens exactly during the evaluation process? So first of all, there is a admissibility or eligibility check. So we have to check if the proposals are eligible to move forward, and there are allocation of proposals to the list of evaluators. Then the experts access the proposals individually with no contact to each other. And there is a minimum of 3 experts per proposal. Often could be also more, but at least 3. And then all individual experts discuss together to agree on a common position after sending their own individual assessments, and including all comments and scores for each proposal. Then there is a final panel of experts that reach an agreement on the scores and the comments for all the proposals within the call, checking consistency across evaluations, and also, if necessary, resolves any case of there is some conflicts. And finally, the Commission or the agency reviews the results of the experts' evaluation and puts together the final ranking list. So in a macro scale way, this is what happens under the standard evaluation process. Before we go deep on this, just let me put here the key strategic orientations for this cluster. Don't forget to get involved on each of these key strategic points. I will not read this for sure, but we will keep these afterwards. So, looking in deep for the evaluation criteria, we will divide it, or it's common to be divided in 3 main criteria: excellence, impact, and implementation. So the quality and efficiency of the implementation. There is a threshold for each of it, which will be 3 out of 5. and then at the end we will have to sum up all of the results in order to check if we will be funded or not. The thresholds for the ends, it will be 10 out of 15. So let's go deep in each criteria. So we have the excellence, the impact, and the quality and efficiency of the implementation. And in this excellence, I will highlight four main topics that I would like to share with you. And I think it would be important for you to better understand. The first question that you must highlight in order to starting to answer these excellence criteria is how strong is the scientific and technical quality of my proposal. If you take this question in mind, you should write it down everything. So first of all, we must clearly state the overall aim and the specific objectives of our proposal. And here it would be easier for the evaluators if you could take into account this SMART approach. So each objective or each aim must be specific, measurable, achievable, relevant, and timed. And if you take these in your hands, I believe that you will be able to define the specific objectives really clearly. One tip that I will give it to you is start with a summary table, listing all the objectives and linking them to the corresponding work package or outcomes. This is not useful for the one that are writing down the proposal, but for instance, also for the evaluators, because it has like a big pictures of what you are doing, crossing the objectives with each work package, okay, or what outcomes. Then we should look for the relevance and the novelty of your proposal. Here you must demonstrate understanding of the state of the art in your field, so the field that you choose for your proposal, and show how your approach or your technology goes beyond what is currently available. It's really, really important to be clear on this, because this proposal must give a step forward on what is been done so far. One of the tips that I can give it to you is to include a brief literature review or a landscape analysis with reference to recent European Union funded projects and scientific publications. And with these, you make your statement, and then you explain how you go beyond all of these achievements that was already done before. Finally, we have the soundness of the methodology, and here you should justify your choice of methodology, not only explaining what you want to do, but why you are doing that, including sampling strategy, data collection, analysis, techniques, and validation. And of course, never forget to address the ethical aspects and the regulatory frameworks. We already discussed this before my intervention, so take also this in mind, and be really clear and transparent when you write down your methodology. The evaluators must to understand not only what you want to do, but how and why you are doing that, okay, to justify your shoes, what you are choosing, sorry. One of the tips that I give to you is use diagrams or flow charts to show the logic and the sequence of actions. For instance, intervention logic or the clinical trial workflow. It really, really helps the evaluators, but also helps all of the partners under the consortium to understand how all of the work package and how all of the methodology can cross to each other. Okay, so I used to say that this is something that should be done at the beginning of this building process of writing a proposal. You should define the objectives, the outcomes that you'd like to achieve, and then design something, draw your own scheme, and then or diagram, whatever you want to call, in order to see how everything will be connected. And then the interdisciplinarity and the gender dimension. So regarding the gender dimension, we already address it here under this session, and in the research content is really relevant if you could get it in your proposal, and then clarify the integration of a multidisciplinarity approach. Okay, this multidisciplinarity approach will enrich your proposal pretty much. Here, one of the tips that I can give it to you is to include a section called interdisciplinarity and gender relevance, for instance, to demonstrate awareness and intention, exactly what you intend to do under these both main topics, okay? So, under the excellence criteria is more or less this that I would like to highlight, and then on the point of view of the evaluators, the question is, what are the expectations of the evaluator? So the evaluators expect a well-defined, specific, and measurable objectives. So you should follow that. You can use the approach of the SMART to write down the objectives, and then a coherent methodology, including data collection, analysis, and validation. This last one is quite important. Then the innovative approach clearly demonstrates with evidence why your proposal are innovative. So the suggestion that I give it to you is to write it down, the state of the art, what was already done so far, supported by references, and then showing how you are going to move forward on these, and these clearly show the innovative part of your proposal. Then the scientific rigor and the rationale for choose an approach. It's not only important to say that the approach that you'd like to use are well then defined on the literature and are good enough to achieve the results that you are expected, but also why that one are much better than the other, okay? And finally, the ethical considerations should be also addressed and really highlight on your proposal text. Then the second criteria that we will assess is the impact. Here, I would like to highlight two main topics. Before it, you should take in your minds one specific question. What is the potential of the project to achieve meaningful outcomes and societal, economic, or scientific benefits? If you can answer these properly, I believe that evaluators will assess really well your proposal. So the first highlight that I'd like to give it to you under the impact criteria is the pathways to impact. So explain how the project's results will achieve the expected outcomes of the call, and why your project, your proposal will give the answers for these expected outcomes. One suggestion or one tip that I give it to you is to use the theory of change or the impact pathway diagram to map all the activities, from the activities to the outputs, outcomes, and also long-term impacts. You can see, for instance, this scheme answers the needs, the participants, intervention, and also the outcome, always asking, answering the why, who, how, and what. And also contribution to EU policies and societal challenge. Here you have to refer for instance, one tip that I can give to you is refer directly to the expected outcomes listening in the work program that was already presented here as well, and clearly align your proposal to them. So cross the information that are listed in the work program with your proposal. The other highlight under this impact is the measures to maximize the impact. Okay, so suitability and quality of dissemination, exploitation, and also the communication strategy. So this is really important from the last couple of years under the Horizon Europe proposals. Describe who will use the results, how they will use it, and when they will use the results that you are creating or that you intend to create. Then plan the outreach activities to the general public and relevant communities, and briefly mention your data management plan and open science practices. Okay, this could be used for to link the outputs to exploitation roads, target groups, and expected impacts. And these the evaluators expect to create and plausible impact pathways, to the engagement strategy with stakeholders and end users, and also a clear dissemination and exploitation plan. This is something that you should also consider under your proposal. Logical link between results and longer term impact. So something that will enrich the way of your proposal to be assessed is this link, and also to create smart impact indicators in order to help the assessments. And finally, we have the last criteria of assessment of your proposal, and here is the quality and efficiency of the implementation. You should bear in mind one question: is the project feasible, and is the consortium capable of delivering? So here I will highlight like 5 main topics under these criteria. One of those is the work plan structure. Okay, describe work package clearly, defining the objectives, the tasks, and deliverables, and this must be really like highlighted, okay, under your proposal, and include also milestones and success indicators. These indicators should be smart, okay. The quality and effectiveness of the work plan should be also highlighted in your proposal. One of the tips that I can give it to you is to use the Gantt chart, because the Gantt chart diagram will help you and will help us evaluators to visualize timing and interdependencies, and will help to understand why some work package occur in some way, and because in some cases they are interdependent from the others. The other highlight that I'd like to give it to you is related with management and governance. You should define properly your project management structures. Some examples are steering meeting, who are the working package leaders, if you have advisory boards or not, and detail the roles and the responsibilities for each partner. So we shouldn't have any gray area on this definition. We should really clearly understand who do what, okay? Also provide a clear budget reasoning, and then work on the appropriateness of management structures and risk management strategy, okay? This risk management strategy is important as a contingency plan if something goes wrong. Then one of the tips that I would like to give to you is to include a clear table showing the partner roles by each work package and the person's month per tasks, and also all required competencies and sectors, if all the required competencies and sectors are covered under these governance, okay, structures. Then we have the consortium composition. This is sometimes really hard to build, but you should simply justify the selection of each partner and their complementarity. So I used to say that you shouldn't put all of our friends at the same box because they will not complement our proposal. We should look with a real transparency for what we really need to enrich the proposal, okay? And this will be checked by the evaluators, how we can find the complementarity from each partner, okay? You should also highlight the relevant past experience that you have, because this will support your capability to do the project, and then the capacity of the participants themselves, like the experience, the infrastructures, the different networks that they are involved with. So you should ask, for instance, are all required competencies and sectors covered? Once again, you should take into account, and also add, for instance, a subsection's title, why this consortium? Why? Provide 2 or 3 lines explaining each partner's unique contributions, because this will enrich a lot the way of understanding their relation under the proposal. Then the risk management, I already highlighted this before, but you should identify the scientific, the operational, the financial, and also the regulatory risks that you should face if you are executing your proposal, and then provide mitigation strategy for each identified risk. Here, you should use, for instance, a risk table with column of risk, likelihood, impact, and mitigations, because this will give us, as evaluators, a vision that you already think about some possibilities, some negative things that could happen during the project's framework, and you already identify the way of solve that's pretending problems. And finally, the resources and the budgets. You should justify the use of all of the resources, like breaking down by work package and by partner, and then ensure consistency between the effort and the budget requested. And here, you really should avoid budget inflection or also underestimation, because both will raise red flags for evaluators. And then you should also ask yourself if the effort and the budget justified are really justified per tasks and partner, okay? So be really clear and honest of what you really need. Sometimes you really need more, other times you need less, but justify it every time you do it. So what evaluators would expect under these criteria? So a coherent and a realistic implementation structure, okay, and should be strong, and then efficient use of resources, no over or underestimation, and then complementary, interdisciplinary, and international consortia, of course, then clear and appropriate risk management, and of course highlighting the contingency plans, and then a gender balance in staffing and management where applicable. And you know that we are also working on this gender balance and gender inclusion, so this could be also highlighted. So before finish this presentation, who could be the evaluators? So who are they? They are independent experts that are selected and appointed by the European Commission. They are experts with relevant academic, technical, and policy expertise. They sign declarations of confidentiality and no conflict of interests, and they guiding principles for evaluators include independence, impartiality, objectivity, accuracy, and also consistency. So from now on, also the Canadians can also register here. You will find the link. So please, if you also are interested to be one of those, go ahead. And finally, I know that it's massive information right now, but I will leave it with you. This is like a bonus part of the presentation with the common mistakes that you should avoid, okay, when you are writing down your proposal. So some mistakes, for instance, vague or broad objectives, poor aligning with call text. And here, Isabel highlighted, for instance, in her presentation, the importance of the scope related with the scope of the call. And here, the explanation why it could be problematic and what you should do. Okay, so some tips that you could use as soon as you are writing down your proposal. And here, how can you should focus in your area and the action that you can use to support your focus area. This is not for me to read, it's just like a kind of offer that I give it to you. And I hope you had enjoyed. Thank you so much for your attention. And I'm really happy to present. Thank you.
Thank you so much, Marina. That was very comprehensive. I see that you have also some questions in the chat you can answer. I think that what we really understood is that, you know, evaluation process is very much a heavy process, but it also doesn't end with the proposal submission, but it also can be extended, and it usually is extended throughout the lifetime of the project. So now I wanted really to move to the next part of our program. And I'm very happy to have with me representatives of a project, a Rescue Plus project. And I hope that they are both here. Yes, they are. So it's my pleasure to present to you Rupal Sedani and Henrik Knoche. They both work on that project under Horizon Europe. Rupal is an experienced healthcare professional with over 20 years of experience in commercial marketing and project management roles, and she's currently leading the Global Stroke Center certification program at the World Stroke Organization, and supports the dissemination of the Rescue Plus project. And with her, we have Henrik Knoche, who is associate professor at Aalborg University in Denmark in the Department of Architecture, Design, and Media Technology. And he's actually a co-leader of the Rescue Plus project. And we will be talking today about their journey, actually. So I wanted to ask a few questions to start our conversation. And this is the question to both of you, to Henrik and to Rupal. Can you tell me a little bit more, or tell us a little bit more about the project? Because I think it's very unique. We very often get the questions about the global impact of the Horizon Europe project. So I thought that yours is an excellent example. Please, who would like to talk a little bit about the project?
Yeah, maybe I can start this. So hello, everybody, and thank you for having us. So as you learned in the previous presentations, this call that we responded to in this case was top down. So there was a call that gave us a lot of things that we needed to address. And at the center of it was the reuse of registry data. And so the project is called Rescue Plus, and the main registry that we have is Rescue. Rupal can tell you much more about this part because she's been involved in this for years. And so this registry that is collecting data about how people are being treated for strokes in hospitals. So that was the starting point. And I guess the uniqueness from this get-go situation is that we had a large number of hospitals actually as potential sites that could use our technology that we're developing in the project, and therefore generate a lot of impact. And we were also joined by the World Stroke Organization, because the registry is focusing on stroke. And we had 2 more, let's say, impact generators on board. One is the Stroke Alliance for Europe, and the other one is the Angels Boehringer Ingelheim, who are basically out there to certify and give awards to hospitals that achieve certain levels of care. And I can tell you much more about the technical composition if you would like to, but that was the starting point where we began our journey.
I see that you want to add things.
No, not really. Hello, everyone, and thank you for having us. I think Henrik explained quite broadly that what was the starting point, and the foundation was actually on the rescue registry. So that was the big foundation, because it had like a database which served as a good example, or a example on which, or the sample size on which we could build actually this technology and these products, which are used, which would be used not only in the European space, but also can be scalable. It's scalable across the world, because Rescue Registry is one of the largest international registry for stroke, and it's used in more than 83 countries worldwide. So that was the advantage, that you had a very good sample size to begin with, and to build the technology around this. Yeah.
This is interesting, because we can actually see how the Horizon Europe project can have a global impact, and it's not only focused on Europe. And that is one of the questions that we really want to answer, and the myth that we want to burst, that Horizon Europe does not need to really benefit only Europe in the research. So can you tell me now, thinking a little bit back, how did you go about finding the right topic, and what was your approach as regards the consortium building in this area? Can you share some thoughts, some lessons learned from that experience?
Yeah. So as I said before, right, it was top down. So the call task, basically, or the call text had included, for example, that we need to create virtual assistants that would help in health settings. So virtual assistants meaning chatbots, basically. So that was very much defined from the beginning. It also required us to make data interoperable, so it can be used, and I mean, that's a big thing in Europe, right? Making data basically go from across country borders. So there was requirements for interoperability and exchanging data, making it machine readable, for example, meaning that we needed ontologies to describe the data and so forth. So actually, if as a call, it was very prescriptive on what we needed to have in the proposal, but it did not say how we would combine these things and how we would match this. So basically, from the beginning, we had a number of technical concerns that we needed to address, and that we needed to shop for partners for. And there were specifically also, of course, legal concerns, and GDPR was a big issue in that. So we had a list of requirements, so to speak, of partners that we needed. And then as we began the process of putting and adding people to the consortium, of course, we wanted to make sure that we maybe use some of their good experiences from previous projects or implementations, because these projects are quite, let's say, challenging task to run. We've encountered all sorts of problems. We'll most likely talk about that later. But so, you know, shopping for partners, you want people that you can trust, that you can trust long-term, that they're responsive during and later during the project time. They have the ability to deliver actually, and interest in this. I don't know what kind of expectations people have here that are in the audience, but not only are these calls and these projects very competitive, right? You're looking usually at single digits success rates, but when you run the project, it's not like you just get money and then you run and everybody does their thing. You know, you have periodic reviews, you have reporting duties, and so forth. And if you do not deliver, basically, then funds get frozen and all sorts of things can happen. So it's very much a very how should I say, well monitored process that you're facing.
Rupal, you want to add anything? Because
Not really. I think he
Not-
covered pretty well. Yeah.
yes, so I actually wanted to follow up a little bit on this because Henrik, you were talking about the importance of trust when you build the consortium. So what would you say, you know, to people in the audience or to the Canadian institutions who might not have a network with any European partners yet, so that trust is not there yet? What would be your view as the consortium leader when you're looking at an institution that you really don't know personally, how they can have a chance?
Yeah, that's a very good question. I guess the first thing is that you want to be proactive. You know, you should have an idea of what you want to do and can do, and you know, show your competencies. So you know, there are matchmaking events that you can, for example, go for and see what kind of projects are shopping for partners. You can also just go there and announce yourself that you're interested in a call and see whoever bites and might be interested in your skill set. Another thing I would just do is looking at previous projects. You can go to the portal and find out what kind of projects were funded, what they were working on, and contact partners that have been participants there, find out who they are, and then I would not hold back and maybe just shoot out an email. Most likely, if you at least in the research space, you might have encountered some of these people already anyway. So I think that's an easy way. The research was very internationalized, right? So if you have been a co-author or met at a, I don't know, jointly organized a workshop or something, right, where you shared workload or responsibilities. So I think you can pull all these different strings potentially. From the company side, I'm not as experienced there, what you could do there, but most likely you might have subsidiaries and so forth that are out there and could check what they've been who they've been interacting with.
So, the next question to you. How did you go about defining the roles of the partners? We often hear that in the European projects in Horizon, actually the partners have a big role to play. Could you expand a little bit on the concept of the work packages and how did you organize that?
Yeah, so in terms of it's a bit of a chicken egg problem, actually. As people join the consortium and you discuss what your plans and ideas are and you put them on the table, things are constantly evolving. For this project, I think we had 56 Zoom calls, of an hour or longer. that in which we were trying to understand what we would do and who could deliver what. And so at some point we had a sort of a broader idea, and then we could break things into different work packages actually. And then we could split up the work actually of writing the part B of the application. So then typically the people that have been very active or proactive in the discussion so far would then be nominated as work package leaders, and they would then get the task to detail the tasks within the work packages and be then the people that would meet on that level. So we would have more concerted discussions actually for the project as a whole and how things would interact. And then they would, within the number of partners that were involved within a specific work package, they would have specific calls and try to develop the details further.
So then it also means that these people would be supported in meeting all the evaluation criteria, right?
Yeah.
How would that go?
Yeah, the evaluation criteria, I think this is actually a very, very tricky one. And what we had, and what I can highly recommend actually, that as part of your consortium, you include potentially a consultancy that has already experience with EU projects. This has helped us tremendously to sort of shepherd and streamline us through the process. It's a big task. You know, as I said, you know, those 56 meetings are only the tip of the iceberg, really. There was a lot of writing and you know, correcting things and so forth involved. And yeah, having an experienced partner in the project, I would definitely also say that this is part of our good mix actually that we have in our project, that we have an agency in there that is specialized in grants applications and running Horizon projects amongst all the other partners we have.
So then can I ask you, what is, like, following up from this, what type of support you got? Because that what you just mentioned actually implies some funding support to write the project at all, because you have to pay the agency, right?
Yes. So so I'm based in Denmark, and in Denmark, as a university, but also as a company, you can actually apply for EU you know, seed funding, so to speak. So you can apply for money to write a proposal. And so there's, you know, so you write a proposal to get money to write a proposal. So it's low effort typically, and you know, it covers, I don't know how much it is actually, you know, it's maybe 5,000 to 10,000 euros or something. But you know, it gives you a start to reach out and get professional help in this case. And this agency gave us a lot of management advice and basically streamlining the process of writing the proposal, you know, from a very different structure actually what I had expected. You know, we're not working really on the part B yet, but they had, you know, all the partners deliver certain bits and pieces that then could easily be turned into this application later on. So I thought that was very efficient actually.
So this is basically, it boils down to having someone who has a bigger picture in mind and helps you fill in a very structured gaps, I would say.
Yeah.
Or
and especially even if they
template.
have the experience of the, you know, working on some other European Horizon projects, so there is they know the expectations of it, and that definitely helps because not everybody in the consortium has an experience about the you know, what is needed. And we saw in the previous, you know, lectures just now, and the expectation is quite high, and you know, and it needs to be really met, because with our experience, I think now almost 3 years into this project, I think it is every step is measured, every step is monitored well, and so really you need to be on the top of the game to deliver whatever was said actually, in the previous sessions. So definitely a professional agency has helped us tremendously in going through and meeting the timelines, meeting the requirements and the expectations, and keeping the consortium and the different partners who are spread across 13 countries around. So that definitely helps.
Yeah, another service that I thought was really helpful was that they actually had an evaluator, somebody who was often evaluating Horizon proposals, and this person gave us basically a sort of a simulation of the evaluation, and gave us even some scores about the 3 criteria and so forth, which was also very helpful, because that was a person who did not know anything about all the ongoing work, but was just looking at what we had written at that point.
Yes, so this is indeed important to have this mock evaluation, right? To know where you stand. Can I ask you how long it took you to write the proposal?
Well, we started, I think, around this time, and then the deadline was in September. So we used the summer months, actually.
4 months, I think, 4 to 5 months.
Yeah. And some of it was much more intense than others. The last 3 weeks, I think, before the proposal was submitted was very, very high intensity. Before, things are still up in the air, and lots of things are still evolving. So it was not as let's say, concentrated, but that changed rapidly later in the process.
So I assume you didn't have a lot of vacation that year.
Yeah. Well, actually, we managed to have some vacation, but it was, you were still on call, right? And this is part of what I say, you can't just be going on holiday and then not responding. That's a sure sign for you're not interested enough to prioritize this. So yeah.
Okay, so this is a good test for the partners then.
Yeah. Yes, exactly.
In a way. Okay. Right. We do not have a lot of time left, so I will just quickly ask you, maybe Rupal, how do you define your role in the project? Because you have a very specific role there, and maybe it's not the usual role that people know about. Can you answer that? What is it that you do?
Well, my role is so I'm not a co-PI, but I worked on different aspects because I managed this registry, the rescue registry. I'm the global lead for that registry for past 4 years. So I was well versed with what are the unmet needs which are still there in the area of stroke, where we were basically across the globe, because not only Europe. And then when we actually worked on this call, this definitely, my contribution was to actually mention also that what are the unmet needs, that we definitely need some standardization, we need some harmonization around, which will definitely help, to scale up and, have a high impact across the world. And talking about this disease condition, which is like a second leading cause of death and disability, all that. So that was actually where I contribute, because I have connection with the various stroke organizations around the world with who I work. And then eventually now I also work with the World Stroke Organization as well. But before that, I was, my role is also as part of the dissemination, because my major part goes in the implementation. It's not about just developing this product, but the real impact is actually if people use this product, and only then you will be able to make that difference or reduce the burden and, have those societal, economical impact or the health impact across. So I think that is my main role, is to disseminate this product. And that's how I work with the partners, the dissemination partners who are part of this, including World Stroke Organization, SAFE, as well as Boehringer Ingelheim, the Angels Initiative. Because everybody has a role to play. And so the angels are like, there are consultants all over the world who are working with the hospitals. So definitely my role is to collaborate with them and then ensure that, you know, this kind of a product, once it is made, you know, it is disseminated to the hospitals across the globe. And so is with the World Stroke Organization and with the Stroke Action Plan. So that is my role. I would say that you know, it helps to use my reach and the partners who are involved as well as part of this project.
This is really important, right? The way that the dissemination works, that it really has to be very palpable and concrete with the real impact, right? So it's not only about writing an article or 2 or 3 or 10. It's really to have a real life usage of the of whatever the projects deliver. And this is, I think, the truth across the clusters and across the project. You always have to have something tangible out of the project. It's not only about the academic, you know, excellence, and we have to remember that. Because I understand, Henrik, that of course academic excellence is a part of it. You have to publish as a part of the dissemination, but not only. Am I right?
Yes, exactly.
Comment.
I mean, what we're doing right now is actually part of our dissemination efforts, right? That we do go out and we tell about our projects in the world, about what we learned, and in this case, it's more about the, let's say, administrative and strategic parts about the project. So it's not so much about the content, but yes. So it's not about just publishing. And there's actually one of the deliverables we had to produce was actually a very detailed dissemination plan on how we would go on about fulfilling the targets that we had set out in the proposal, right? And that includes various things, you know. I mean, obviously publications, but also involving other stakeholders from society, outreach, and so forth. So yes.
Yeah, and it's not only at the end of the product, you know, when the product will be delivered. In fact, it is an ongoing dissemination, because every, you know, international conferences or the stroke conferences, we present about quality monitoring, we present about the broader picture, but we always talk about, you know, this kind of a project, because it gives you a flow and something which people are looking forward to, like a future. Where are we heading towards? You know, so it actually helps you for your current project as well, whatever you are working on, as well as people are looking forward to already that, you know, what is coming up, and you create this interest area around the world. And yeah, that's what we do as part of the dissemination. Yeah.
That's very good. Okay, because we really have to maybe wrap it up. I would like to ask you then, shortly, you've heard the presentations, you know, you have been with us. What is your one lesson learned, maybe challenge, and advice to the Canadian institutions and partners who are looking at Horizon Europe and would like to get involved? One thing that you think is important to succeed.
Focus on what you can deliver and make yourself available. I think that is the, you know, be proactive and show what you can do.
Rupal?
I was going to say about make yourself available, because it's so important to be, you know, to run, because it cannot be driven by just one person or two. But yeah, I would say, you know, the message is, you know, although you might have the leaders, but you need to have a constant checks time to time, you know, so that to ensure that every partner is fulfilling their responsibility, and that, because that's very important. You don't get caught off guard, you know, at the last minute, and then you have a contingency plan to work on. So I think that's very important in such kind of projects which are so measurable and so monitored. I would
Thank
I
you so
would go with
much.
that.
Right, this is really useful. I don't know if people have any questions to the project. I think that there are already, I think, one or two in the chat that you could answer. And then I really encourage everyone in the audience to go to the website of the project and have a look what they are doing. It's really amazing that the use of AI to save lives. It's important. And now I wanted to move to our next speaker, who is Joshua Atienza from ICET.
Thank you, Agnieszka.
And who is, well, I need to introduce you, of course. So Joshua is a policy analyst at Innovation, Science and Economic Development, so ICET, Canada. And he leads outreach and engagement initiatives on Horizon Europe, with Tamara Sone, who is the Canada's National Contact Point Coordinator. And the National Contact Point. So Joshua knows, of course, very well the NCPs on Cluster 1. And he brings both scientific and policy experience to the Horizon Europe team. He has been answering some questions. So if you have more, he will be answering more after the presentation. But I think that this is important to have you here, and you can speak longer than 5 minutes, you know, so no need to rush.
Thank you, Agnieszka. So maybe I'll get started. I'll just maybe quickly share my screen. I think we're good to go here. All right, hello everybody. As Agnieszka mentioned, I'm Josh. I'm a policy analyst on the Horizon Europe file that's kind of based out of ICED, which is Innovation, Science and Economic Development Canada. So I work outside of the Secretariat, or within the Secretariat rather, and a lot of the work that you do, and I think we've engaged with a lot of stakeholders on the call today, is obviously promoting the program, but also working with the NCPs to make sure the Canadians understand what it means to participate in the program. So a lot of the work that we also do is also facilitating connections between Canadian researchers and innovators here at home, but also with their counterparts in Europe. So I look forward to this presentation, and as Agnieszka said, if people have particular questions, I'm happy to answer them after. So I know there's a couple questions about, you know, how to get started, and I wanted to kind of situate the Secretariat in terms of how we're able to help. So I think as the different that makes sense for you, right, and your expertise. So I think once you've identified a topic, the next logical questions that most people will come to us is, okay, I have a topic, I'm an expert in this particular field. How do I find partners, right? We saw that in the Q&A as well. So obviously, as other experts have mentioned, try to leverage your network as best as you can. I think that's the best starting spot. But also the European Commission is organizing a lot of other events that might be of interest to you. So for example, in this month of May, they've been hosting Info Days, which kind of go over the work program in its as a whole, as an entire entity of the different destinations, where you can learn more about what they're looking for, but also there's people equally like yourself that are interested in these work programs that you can partner up with and try to find partners that way. Obviously, there's other traditional kind of resources as well from the Commission. So there's the EU Funding and Tenders portal. There's also the European Enterprise Network that does a lot of work with partnering organizations as well as you can find successfully funded projects before through Cordis, which is like the main database for the European Commission for EU-funded projects. In the context of the Secretariat, but also our national contact points, we've been doing quite a lot of work in terms of supporting partner searches as well, and that could be individual to the level of, hey, I'm interested in this particular call. Do you know anybody that works here? But also maybe more broadly, we're doing quite a bit of matchmaking events in the month of May and also in the month of June, and also moving forward to make sure that, again, Canadians are able to participate in these calls with successful consortia. So obviously it's not for Cluster 1 at the moment. We did one with Cluster 1 actually last month in April, and that was attended by like 500 different people. So we're trying to do more of those. So there's a couple other matchmaking events that are kind of in the works at the moment. So we continue to work with our national contact points, but also the Trade Commissioner Service to, again, facilitate these opportunities to connect. I just want to maybe quickly explain the role of the NCPs here. So as part of our association agreement to Horizon Europe, we had to establish a dedicated system to support applicants through this process, particularly Canadian applicants. So that's what the national contact points are more often colloquially kind of referred to as the NCPs. Like, they're going to be the Canadians' main structure to provide guidance and also practical information in their participation to Horizon Europe. So we're really lucky to have an NCP for every cluster of Horizon Europe, and some of them even extend to the missions, or some of them kind of go in between the clusters. So please feel free to make use of them. We're in constant contact with them and making sure that they also are well-versed in what's happening to the work programs, as they also attend the program committee meetings where these calls are developed. So one other thing is that obviously I think they bring a lot of sector expertise. Our NCPs are from different parts of government. So, we have NCPs from, for example, Will and Barry, that are from the National Research Council, also colleagues within, Department of Fisheries and Oceans. So they're kind of all over the place. And again, they're able to offer sector insights. A couple other things. So just maybe I want to point your attention to just the contact information of our NCPs. So the main one that would apply for Cluster 1 would be Barry and also Will. So I've had their emails up here. If you have any questions, please feel free to reach out to them. They are some of the most fantastic people that I've worked with. They're also super knowledgeable of the program. And yeah, they've worked through a lot of the intricacies of Horizon Europe as well. As I mentioned, there is an NCP for every cluster, so there's a lot of support going around. And again, the Secretariat is making sure that we also produce a lot of support materials for NCPs, but also our Canadian stakeholder ecosystem in general. So I left that up there, but again, just showing you the range of NCPs that we have. If you have any other general questions in terms of just getting started with Horizon Europe, or just trying to really dig deep, and now that you've kind of are looking for partners, we're continuing to develop a lot of resources. So for example, our website will be updated with a lot of applicant tools in the next couple of months. As well as, we also have our distribution list, which has now grown to like 1,700 people that we kind of regularly kind of contact for events like this one, but also our matchmaking events that are happening this month. So please sign up. And again, if you have any general questions, please feel free to reach out in our general inbox. So that's Horizon Europe at isad-isda.gc.ca. And we're happy to kind of answer any questions you may have. So thank you for the opportunity. Again, if you have any questions, happy to take them here.
Thank you. That was really useful. We are very happy to have the Canadian partners here, and we hope to have very good results over the next few years, with more and more Canadian institutions actually joining the consortia. That this is the aim, right, of whatever we are doing. So I don't know if we have any more questions. This is your last chance, because we will be closing this event in a few minutes. So please just write them now. I want to recall that the recording will be available at the YouTube of the delegation of the European Union to Canada, and we will be sending the presentations to everyone who have participated. So now I will invite Zara Pinheiro Lozano, the program manager at the delegation of the European Union to Canada, to close this session and to give the closing remarks. Please.
Thank you very much, Agnieszka. It is really a pleasure to be able to be here with you. I would like to thank you so much for your participation to this webinar. We really hope that it was useful to you. We are hoping that with this series of webinars that we're doing on Horizon Europe, we can encourage you to look a little bit closer to the program and encourage you to participate. We believe that this is really a great example of the great cooperation that we have with Canada. If you have any suggestions on how to improve these informations, we would also encourage you to get in contact with us. We would be very, very grateful to hear your feedback. And just to let you know that this, as Agnieszka already mentioned, so we will be posting uploading this video on the EU delegation's YouTube channel, so you can have access to this webinar's recordings as well as to the other recordings anytime you like, and also to announce that our final webinar will be will be on June 4th, which is a Wednesday, and with this we will be closing the series of webinars. So we will have gone through all the clusters. And just to also to take this opportunity and thank very much also to our speakers both here in Canada and with ICED and also in Europe for joining us. This is really great. We really value your participation and your engagement in this dialogue. So thank you very much, and we hope to see you again very soon. Thank you.